welcome to our panel where you're going to get to hear from all of our directors and a little bit about our company and kind of how everybody got where they are and what fuels their passion for the fields that we're in. So MPG is a multidisciplinary, started as a psychology practice by Dr. Josh Rosenthal. It has evolved to now a team of over 200 plus, which includes our adult and child psychologists, neuropsychologists, board certified behavior analysts, special educators, and ABA therapists. We provide services in person and virtually. In person, we are on the Upper West Side in Manhattan. We provide in-home services, school and community for our ABA services in the Bronx, Brooklyn, Manhattan, Queens, and a few other areas. We do provide wraparound care. So from the start of services, we have children who are getting neuropsychological assessments with us all the way to getting therapy with us, which I think is a very cool thing that we offer so they can receive the full spectrum of care, including therapy services. We provide CBT, PCIT, SPACE, and a variety of other therapies. We do provide services that can be paid via private pay, commercial health insurance, or through the DOE's in partial hearing orders. So you are going to get to hear from all of our leaders from each of these areas, from our psychology, behavioral, and educational services. Oops. At MPG, our vision is to create a future where individuals and their families feel supported, connected, and empowered, which is embodied in our wraparound care model. And our mission is to provide multidisciplinary integrated support for individuals and their families who experience mental health, behavioral, and educational challenges. All right. As we get started, I'm going to do a quick introduction to all of our speakers. If you have any questions, you can toss them in the chat or the Q&A. Either one will be monitored and we will ask them at the end. As we go through each question, you will hear from every one of our speakers. So our first one will be our owner and CEO, Dr. Josh Rosenthal. We will then have our Senior Director of Clinical Operations, Dr. Ariel Kornblum. And then our Clinical Director of Mental Health and Testing Services, Dr. Francine Zeltzer. Our Clinical Director of Behavioral and Educational Services, Michelle Charles, and finally, our MPA's Director and Supervisor of Commercial ABA. All right, so first question is, what led you to pursue a career in the mental health field? And Josh, you can kick us off.
Thank you, Lakin. Thanks for the wonderful intro, and thanks for organizing this with Beth and everyone else. I think this is a great opportunity for us to share our experiences and hear from people that are getting into the field. I think personally, it was a personal experience with going to therapy. My parents got divorced. We all went into therapy, and I had a really positive experience with a therapist. And this person helped me, helped my family, and I was like, okay, that's what I want to do. And then I just kind of pursued that path all along. In high school, I was pursuing opportunities to be around clinicians and be around people getting services through volunteer opportunities. In college, I was a psychology major, and looking for more opportunities. And then grad school, I just kind of knew that I wanted to work with families and be a practicing psychologist. And even more than that, I realized that I wanted to work with kids because adults are kind of a waste of time. You can't really help adults, but kids, you can really help adults, or you can really help kids. So I got excited about working with kids and parents. And, when I started the practice, 100 years ago in 2008, I had no idea where it was going to go. I just wanted to see families and work with kids and parents. And along the way, with my wife, Nilu Dardashti, who's also owner of the practice and a practicing psychologist, we were fortunate enough to meet other people who are really good and passionate about the work. And we just grew and kept growing and adding more services. And you realize early on that there's a lot to do. And so I started to transition into more sort of administrative and business focused, and started seeing less and less patients over time. And then a couple of years ago, stopped seeing patients altogether so I could just focus on running the company and supporting our leadership team and coming up with more creative ways to help more people. COVID was a sort of a big jump start to how much is really out there in terms of need. all the people that were thinking about getting help decided to come forward. All the people that were traumatized by COVID came forward. Telehealth was wonderful. So there's just been so many things that have that I've been focused on and working on, and partnering with the leadership team to accomplish the goal of just simply helping as many people as we possibly can. So I would think that that is how I got into mental health.
Awesome. Thank you. Ariel.
Okay. Hi, everyone. I am Ariel Kornblum. I am a BCBA and a clinical psychologist. It's interesting. I've always felt really passionate about psychology and understanding behavior and wanting to help people. Growing up, my grandmother was a special educator. She had her own practice. And when I was in high school, I took an AP psychology course, decided that this is definitely what I was going to do. Immediately declared my major in college. And I was actually a minor in human services because I was interested in nonprofit work for a while. And during one semester, I worked as a behavioral support paraprofessional in a preschool where I went to college. And that family introduced me to the world of all kinds of supports. They had a child who was receiving ABA and PT and OT, and the mom knew I was really interested in the field, and she would take me to see all the therapies. And while I was there, I met another paraprofessional there who was working as a behavior technician. This was before the days of RBT. And she was like, come, get this experience. And I spent a year working as an RBT and as a behavior tech. And on my first day there, I walked into the training, and the lead psychologist came in, started talking about the child and programming and goals. And the first thing I thought was, wow, I want to do that. So that's exactly the career that I pursued. And my passion is at the intersection between psychological work and applied behavior analysis, and really pushing the envelope and evolving the field to serve just a growing population of children, adolescents, and families that really need a lot of help.
Thank you. Francine.
All right. Hi, everyone. Good evening. I'm Francine Zeltzer. I'm a licensed psychologist, and I'm the director of mental health and testing services here at MPG. So throughout my grade school experience, I really had a variety of jobs and volunteer opportunities, everything from retail to finance. I was a temp in a realty corporation. I worked in a tax department. And I had some jobs and volunteer opportunities in the field of mental health. And really, it was those jobs in the field of education and mental health that were really rewarding. And even though I tried many different things, I always would come back to the jobs that allowed me to help others. So I went to undergrad as a declared psych major. And throughout my undergrad experience, I took a lot of jobs and internships in the field of mental health. I worked at hospitals, I worked in camps, and those opportunities really reinforced my desire to pursue a career in mental health, which is what drove me to go to graduate school and become a psychologist.
Incredible. Thank you. Michelle.
Hi, everyone. I'm Michelle Charles. I'm the director of ABA with the kind of DOE funded side of our ABA practice at MPG. When I started college, I knew that I wanted to be in the psychological services generally, but I was kind of maybe a little bit less directed than some of the other people that we've heard from this morning or this evening. And I knew I wanted to work with kids. I knew I wanted to be in psych services, but I was thinking that I would take a path in juvenile detention services. So I dual majored in psychology and in criminology with the intent to get into some kind of juvenile detention reform in the area of autism and developmental delays. There's kind of a huge underdiagnosis in juvenile detention settings, and there's a huge overpopulation of people who are misunderstood or who have developmental delays that aren't even identified. So I was thinking I would kind of go that route. I got through my undergrad with that dual major, and I kind of got into that position that I think a lot of sometimes psych majors, but people who don't know exactly what they want to do get into after undergrad. We're not really sure what to do next. And a friend of mine was in the ABA field, and they said, why don't you apply for this? It's related to what you want to do. You still get to work with children. I think you'd be good at it. And I did love working with children, and I'd never really worked extensively with autism or extensively with severely delayed individuals. But I took the position. I moved across the state into a kind of away from my family, away from my college. And I loved it there. I was a behavior therapist or a behavior technician like Ariel was, and I was doing one-on-one work in this setting that was kind of like a school. And then I got recruited into another company, another state away, and that sort of drove me into this long-term ABA career, where I found that I do genuinely love what I'm doing. And I found that kind of the longer I've been in the field, the more I look back on my career and realize that everything that I've done up to this point has led me into a position that I feel like I can make really big change and really influence the direction that we're going as a field with working with autistic kids or kids with other developmental delays. I have gotten to do positions kind of all over the field of ABA, in administration and in training and in practicing as a BCBA. And then I kind of was in a director position at a company for a long time. And I realized that what I was missing was working with those kids that kind of originally put me into the field of ABA. And that's where I found MPG, who is doing really cool work where BCBAs could be working directly with kids again. I joined this company, and now I get to do both the individual work with the kids, where I'm still treating several kids, autistic kids, with our practice. And then I can also do some of that administration and training and building out pieces of the field that I think, are constantly evolving as we move into this new kind of age of ABA.
Awesome. Thank you, Michelle. And last but certainly not least, Ashley.
Hello, I'm Ashley. I'm Ashley Long. I'm the director of commercial insurance ABA within MPG, our branch of the company's MPA. I had a much less direct path than everybody, so I guess we like circled further and further. I was a declared poli-sci major on a pre-law track when I was in undergrad, so quite a jump. A few years in, realized I didn't want to be a lawyer. I heard some like horror stories of law school and was like, I don't really want to do that. And I had thought I wanted to do that like my whole life, really. And so I was really kind of feeling lost. I wanted to do something where I was more hands-on, like human service, helping people. So I did some volunteering and did some work in the nonprofit world. I was grant writing, just kind of figuring out like what I wanted to do. I really enjoyed that because I knew I was making a difference, but I wanted to be much more hands-on. So after grant writing for a while, I went back and took some psych courses. I was like, maybe I should go into like family counseling or something. I just wasn't sure what I was going to do. And of course I was like, well, I need a job. Like, while I'm figuring this out, I need something related to psychology. And as I'm sure a lot of you know, it's hard to find a job, as an undergrad or having a bachelor's in the psych field that's paying you. So I found this job as an ABA therapist. I knew nothing about ABA therapy. I knew nothing about autism. I did the interview. Oddly, I'm from Ohio. Oddly, this interview was at the same place Michelle had been working as well. And I didn't know her at the time. Small world, but did an interview there. I was kind of freaked out. They, were trying to prep me for like what to expect. I just kind of like, I'm going to fake it till I make it. Started working as an ABA therapist, and it just kind of blew my mind. I fell in love with it immediately. Seeing the progress that the kids and adults we were working with were making all the time, that just kept me going. So from there, I decided like, okay, this is it. This is my niche, and I'm gonna go get my master's. And so I did that, got to New York eventually, and was working in, with some other insurance-based agencies and home. But there are a lot of negative experiences I was hearing from families, therapists, ABA therapists, BCBAs, found MPG and had some great conversations with leadership where it just became really clear that everyone here was trying to do things in a different way to make families' experiences better, clinicians' experiences better. So I just like jumped in both feet, fully ready to try to support that mission. And I'm still here. So it's been a couple of years now. That's my journey.
Awesome. Thank you guys. That leads me into my next question, which is what fuels your passion? So I separated this out for the field you're in because we are all practicing in different areas of the mental health field. So if you guys just want to share a little bit about what fuel, Josh, you can talk administratively or in the psychology realm, just share, what makes you so passionate about the field that you're working in.
Thanks, Lakin. First, I want to say it's really cool to hear everyone share their story. There's a lot of things that I'm learning for the first time.
Yeah.
So thanks again for putting this together. What fuels my passion for the field? So, I mean, my passion for psychology, I think, comes from my personal experience, like Ariel hinted, just really wanting to understand people, understand how the brain works, what makes people do the things they do, especially when it comes to families, right? So, the holy grail in child psychology is, can you actually predict what's going to happen to someone based on what happens to them as a child? And unfortunately, the answer is no. You can have someone who has the worst childhood and they become completely successful in every domain, or someone that has
Hold on one second. I think he's frozen for everybody.
we're so intrigued by it and we really want to.
Hold on one second. Rewind. You froze a little bit.
Oh, sorry. What was the last thing you heard?
That somebody could have like a really great childhood and then
right, so they could have a great childhood and then totally fall apart as an adult. So it's just, you cannot predict it either way. And I think that's what makes so many people interested, because it's not very clear. It's not like this plus this equals this. So that constant desire to understand even better is definitely what made me so enticed by psychology and child psychology and family psychology. And then switching over to the business side, I realized that when I'm sitting in a room and I'm working with someone, even I'm working with a group of people, a family, or doing a group, there's a lot of things happening outside the room. And I started to feel like maybe I could be using my time outside the room to do more to help people than I could be sitting in a room with people. And so it's always a push-pull for someone who is in an administrative role as well as a clinical role. And so I started to feel that pull even more and more and more. And at the same time, there were great people coming into our company that I knew could keep the clinical services going. And so it allowed me to actually step out and be more business and administrative, because there were great clinicians coming in, which I'm grateful for. So, administratively and business-wise, the passion is, how can I help as many people as possible, before I'm gone off of this, we have a short amount of time here. And that's what really drives me, is being able to help as many people as possible, at the most scale as possible. So those are my two drivers.
Absolutely. I completely agree. Having come from a clinical lens and working more on the administrative side of things now at MPG, it's nice to get to hear from those who are working either directly with the populations or who are leading the population, such as the remainder of you guys who have left to talk, and hearing your passion, and not only just hearing it, but seeing the passion within the people that you're leading who are working directly with the clients. I think Ashley and I have talked about this today, is that we're setting our staff up for success. And by supporting our staff are then supporting our clients. And really, I think that is what makes the MPG model go round, is that we are putting so much trust and faith and support into our staff that we are leading them to be compassionate, quality clinicians. And we get to step back and see them continue to just make great strides in the clients that we serve. All right, Ariel, what fuels your passion for the field you're in?
Oh, tough acts to follow. I think that, I will echo what Josh said about just scale and access to therapy. I think that the one of the biggest challenges of our time is access to quality mental health and behavioral health care. So I share that really, really deep-seated passion for getting out there and serving the most amount of families we can serve. Second to that is really, how can we do that in a way that doesn't compromise quality? So access to high quality care where we are, bringing people in, training them, doing ongoing supervision, in the values that we have developed as a leadership team, things that, this group we talk about, all the time. And, in addition to that, like what personally fuels my passion, and I talk about this, whether it's ABA, whether it's psychology, whether it's like the middle ground of both, is really like how we can take all of these things, what we know works, right? Like what we know helps people, what we know supports families, and how can we innovate? There's so much in these fields that are, stagnant and sort of formulaic. And what we are doing here is not that. What we are doing is taking our knowledge, our collective knowledge, and trying to make the fields that we are in better. And every day, if everyone here knows me, but if you ever knew me, like get to know me a little bit better, this is kind of all I talk about. I really, really am interested in sort of evolving and taking all of these therapies, pushing the envelope, taking them to the next step. And we have really spent a lot of time and effort on building the foundation so that we are able to do that.
Yeah. And I will follow up as somebody who works closely with Ariel. She is certainly a image of when you know better, do better in everything that she's doing within the ABA realm. And the supports and efforts she's putting into the team that she works with and pushing Ashley and Michelle to do better. And then they're pushing their team to do better as well. So it's nice to hear that as a team collectively, we are wanting to really improve the field of ABA and make sure that we are making a positive impact.
Thanks,
All right,
Lakin.
Francine, on the mental health side, what fuels your passion?
So on a more individual and personal level, having the ability to educate and advocate for individuals who might not have the knowledge or the ability to do so for themselves, really empowering them and giving them the opportunity to meet their full potential and to feel good about their progress, to recognize and accept that it's a marathon, not a sprint, and to really make a meaningful impact. On a more global level, it's really important to me to reduce the stigma of mental health and taking these strides towards integrating physical health and mental health under just health. Our mental health is just as, if not more so, important than our physical health. And very often, in both areas, we're very reactive instead of proactive, and empowering people to accept that it is okay to not be okay and to know that help is available and not be afraid to get that help when they need it.
Yeah, I love that. I think that describes you to the T in both your work as a clinician, but also as a leader and somebody who is working with a team under you. I see this in how you work with our practice coordinators and our postdocs and our psychologists, and the way that you encourage them to disseminate that information amongst themselves and their peers and their clients.
Mm-hmm.
All right, Michelle.
Yes. So, a lot of what Ariel and Josh and Francine have said, I echo those sentiments completely, especially speaking to the field of ABA, where we are in a period where we're kind of readily evolving and we're looking really closely at our practices. MPG is, but I would venture to say that most ABA companies at this point are taking a really close look at the ethical implications of what we're doing and making sure our kids are happy. And I think the things that drive me the most is having gotten to see some really, really great ABA programs and some kids who learn so much, so happily, and who run up to their ABA therapist and who are engaged in such a positive way in their therapy. And seeing how much of a difference that really positive, kind and nurturing therapy makes against what I've also gotten to see, which is some of those programs that that maybe aren't as compassionate, or that maybe the kids that we're working with aren't as happy with. And I'm sure anybody in the field has seen those programs where the kids maybe run away from the therapists that they're working with, or, you know, maybe are sad that they have to do ABA therapy 3 times a week or however often they're doing it. And while those kids are also making progress, getting to see those 2 different types of experiences that autistic people or other people who are in ABA therapy are having, I think my biggest kind of fuel for moving forward and for disseminating information and for trying to continue to push our practices forward is bringing more and more ABA programs into that first bucket, where kids can have a really good time learning and can learn so much more and learn so much more meaningful information and have a good time doing it, as opposed to learning but being so sad while it's happening. So I think that you know, just being a voice in the field and being able to kind of continue developing our practices toward that first type of program is what keeps me in the field and what keeps me in administrative positions in the field, where I can work with training the next group of ABA clinicians.
Thank you. And just so everybody knows that Michelle and Ariel are leading this new change on the MPG side of ABA, where they are putting into place a more intensive training program for BCBAs. So that way we can reduce the number of clients who are crying and running away from their therapist and instead are happy and excited to see them. So they've started this. We're excited to see the results, and we are lucky to have them leading this charge on the MPG side of things. Ashley, let's hear from you on MPA.
You know, it's funny because as I was thinking about these questions, like it just now started to occur to me that like what drove me to want to be a lawyer, you know, like injustices in the world is honestly what really fuels me in my work here. Because I think there's like 3 things like that frequently are fueling me. And the first one being a lack of acceptance of our learners out in the world, like in their day-to-day life, the challenges that they have to face because people just don't understand them and aren't accepting of them. That fires me up. Hearing stories from families where they've had like a really horrific experience, or they just feel lost. They don't know where to turn. They're running out of motivation. That motivates me to try to help them and guide them in the right direction. And insurance, which I think a lot of us have experiences with insurance in different ways, but insurance is tough. And, you know, I appreciate that insurance pays for these services, but they can make it really hard for families too. So I'm not afraid to fight and advocate for families on the insurance front. And so whenever they are getting pushed back, like that fuels me to really help them, because I know I can push and I have the time where they may not, you know, to advocate for their child. So those are the things that really keep me going in the field.
Yeah, and I think they're so important because a lot of families that are utilizing their insurance may not know what they're going to get out of insurance for ABA services, or the fact that insurance will deny for the requested amount of services. And having an advocate for not only the child, which I think is very important, but for the families is such a crucial component, whether you're doing an insurance-based service model, a private pay, or DOE model. Every family needs somebody to advocate for them, or at least to be on their side to support them, which I think all of you embody in the work that you're doing daily. We had a question in the Q&A and it relates to this one, so I'm going to hold off on our question 3. It was, how do you unwind and separate your own experiences from your patients? Which is kind of a loaded question. So I'm going to let whoever wants to take it. I think it's a good question, and it's kind of goes into one of our questions later on about giving some advice.
Good one. Anyone want to take it?
It kind of does go into this next question, so I'll move over on what is one piece of advice you would give to someone who is pursuing a career in the mental health field. So I think this does kind of align with that. So if somebody wants to touch on it in their answer.
I can, if no one else wants to. I think, honestly, I'm going to pull the age card. I mean, I don't like to use the age card, but I'm going to pull it. I think it comes with experience. First, we'll back up for a second. Lakin, even if no one was watching this recording, I think this would be a cool meeting for us to have because I'm learning so much about everyone.
Yeah.
It's actually pretty inspirational to hear everyone talk about why they do what they do. So anyways, I think experience. I think, in the beginning, when you're a new clinician, all you want to do is do right by your clients and look smart and impress everyone and impress your supervisor and remember everything from your textbook. And that's pretty anxiety provoking. And I think it's hard to let it go because you're in the thick of it all the time, thinking about it and just trying to get, and as you get more and more confident in your skills and you feel good about what you're doing and you realize it's okay to make mistakes, you start to calm down a little bit and it starts to sort of separate from what's happening at work to what's happening at home. Now, granted, you could have a tough case and that's going to be on your mind all day long and you're not sleeping, you're not eating, you're talking to everyone about it. That is definitely going to happen. And we all have those situations. But for the most part, I think with confidence and time, you tend to be able to leave things at work, come home and just enjoy other parts of your life. That would be my answer to that.
Yeah.
I can add to that if you want.
Yeah, sure.
So I think also, as a therapist, it is our job to provide our clients with the tools that they need to navigate their own lives. So I almost think about it as the difference between a GPS and a driver. Where the GPS, we give them the support and the directives, but it's really up to them to drive their own car. And everybody's journey looks very different. So even if we have two clients that come in with similar problems or looking for similar supports, their GPS instructions, their support is going to look very different. So that's something that our lives are different than the lives of our patients, and our experiences help guide us, but our training helps us support our clients.
That's fantastic. Ariel, you're muted.
I see. Sometimes this takes a while, I feel like, to get to this point, but sometimes the best thing or the most supportive thing that you can do for a family or for a child is just to be with them and hang out with them. I think as therapists, we always feel like we need to be doing something. And I spend so much time talking to families about what to expect when they're in therapy, whether it's, psychological services or ABA therapy, and the importance of, knowing when to take a step back, do a nice rapport building session, just be with someone. That kind of connection is really what drives a lot of progress down the road. And I think when you're a young therapist and you feel like, especially in ABA, when you're taking data, you have to take data on every session. It can be hard to remember to do that, but it's so, so, so important. So I guess my biggest piece of advice is to remember that, at the end of the day, you're two people, right? Connecting. And like Francine said, our jobs are to guide people to help them reach their goals. And if they need to take a step back or move a little slower, it's really our responsibility to meet them where they're at.
Yeah, absolutely. Michelle, you want to pop in?
Yes, I can only speak to ABA. I'm not, in terms of the, therapy that Josh and Francine have been able to talk a little bit more on. I think it's a little bit different, but within the field of ABA, the best thing that I can come up with for, my career and for watching other people come into their careers is to find your own style and what you genuinely connect with and how you genuinely connect with children or with adults or whatever population you're going to be working with, to truly find that genuine connection. I think oftentimes the way people end up burning out within a career of ABA is kind of putting a front on, or, we see these really great therapists who are on the floor and rolling around with little kids, and the kids are loving it and the therapists are loving it. And that's a great style for a subset of people. But then there are other people who are also really great therapists that maybe are a little bit different in their teaching approach and in their interaction approach or play approach. And I think there's something to be said for those approaches too. And I think when people aren't enjoying the time that they're spending with these kids, since the programs tend to be a really robust amount of time spent with one individual. If you're not finding the places where your interests overlap the population that you're working with or the person that you're working with's interests, and the things that you enjoy aren't overlapping the things that your client or your student is enjoying, I think that's where people end up burning out a little bit faster, when you're really having to do a lot of like mental labor to make therapy feel fun for somebody. That's where people end up consistently burning out. And so just finding what moves you within the field of ABA, or finding what style works for you. And if you can't find a style that when you end your session, you think, oh, that was a good session, or, oh, I enjoyed my time there, you probably will need to make some type of change if you're going to have a lengthy ABA career path. And so it's just really finding the thing that you'll enjoy within your therapy, that also the person that you're working with is enjoying.
Awesome. Ashley.
Yeah, so I think when I was thinking about like advice I would give, a word comes up a lot in my mind, which sounds a little counterintuitive, like based on what everyone's talking about, but it's boundaries. Because like when I first got into the field, I had no boundaries. I was letting parents call me at all hours. I was available all the time, and I thought I was like doing really great work. And I'm sure they appreciated it, but it wasn't the best approach, and in the long run wasn't the most beneficial for the family. And that's because that's how I burned out. Not having boundaries, it's kind of like, on the plane, the parent takes, I don't know if that's true, but, take your oxygen mask and then help the other people. It's the same thing. Like, you have to have boundaries for yourself and make sure you're advocating for yourself and your time so you can be energized and present for your families, because they don't get a break. So they're needing support all the time. You could, never end a session really. So you have to make sure that you're setting boundaries for yourself. And if you're feeling burned out and you feel like you're not supported somewhere, there are places that will support you. It is really important to advocate and get what you need. So that's, kind of like a general suggestion. But I was also going to just note, if you're in a psych program, or you're an ABA therapist, I think, for psych students, I think getting into a job as an ABA therapist like I did is a great step if you're not sure where to go. So that's some advice I would give, maybe dabble in ABA a little bit. You get exposure to a lot of related services. I've seen so many ABA therapists who aren't sure what they're going to do, and they get into the role and they're like, wow, I'm really interested in this like speech pathology. I'm seeing these speech sessions. I really like it. Or they get into OT, or maybe they do get into psych, but it really kind of opens things up for you while you're able to earn an income, which is really important. So yeah, that's what I have to suggest.
Awesome. Go ahead, Josh.
Can I just answer the piece of advice? Because I was thinking about this. I think that, being both a student, trainee, clinician, senior clinician, administrator, owner, I have this sort of perspective on, what I'm looking for in hiring someone and bringing them on and promoting them and helping them grow. And I think back about how I was as a student and trainee and all the things I would have done differently. So I think this advice could really help. What I would say is, be a super nice, super friendly person. Make sure that you are making yourself indispensable to all the people that you work with. Don't cut corners, go the extra mile, show people that you really care and you're a valuable team member. Think about the long haul. Don't think about the short term, what's in front of you, because that will always be changing. Never burn any bridges. You don't know who you're going to come back to and ask for help at some point. Learn your craft as much as you possibly can. If there's manualized treatments to learn as many as you possibly can, because when you graduate, you're gonna have to pay to learn them. So learn as many as you can when you're in school. and yeah, just be a really valuable team member, and people want to keep you. They will not want you to leave. They'll keep promoting you. They'll find other opportunities for you, and then you'll just get to do more and more of the things you want to do. So that would be my advice for someone interested in mental health.
On the hiring side of things at MPG, I think whenever I'm talking to anybody in our leadership team, the biggest thing that comes up for me is passion. Did they exude passion in that first phone call that they had with me? Because if not, I don't know that I want them as part of our team. I want somebody here, and we all want somebody here who is wanting to make a difference in as many lives as they can. So that's part of my advice, is show your passion. Leave your passion on your sleeve. Let everybody see it. That's something that you shouldn't hide. I also think it's important to find a company that has similar beliefs as you, but also challenges you. You're not going to continue to grow unless you're being challenged, but be respectful about it. Be respectful about the growth that you're making and that you're encouraging others to make. And find something that fuels your passion, that fills your cup, because you spend the majority of your life working a job. You might as well find something that fuels your cup while you're at it. So that's some of my advice. My last one would probably be to take a risk. Try something new. Everybody that's on this panel today at some point had to take a risk and be part of the ABA field. Go to grad school, which grad school is a risk in itself. It's more school, it's more learning, and then you have to do your internships, your externships, a postdoc, all these things, and you have to meet new people who have different passions than you, and you have to learn to engage and interact with them. So find something that fuels your passion and allows you to take new risks, is my advice. All right. Question 4. This, again, is a very loaded question for both the mental health and ABA field, but how have your respective fields evolved since you started your career? And I know we could all go on for probably like 3 hours for each field. So if you want to just break it down a little bit, but I'd love to hear kind of your guys' thoughts on how has it evolved and what are ways that you have assisted in evolving. I know Josh had mentioned COVID earlier, which was a big deal for the mental health field. So yeah.
Should I go, or does someone else want to jump in?
You can go.
I'll go. I think pre-COVID, what was happening is there was a shift away from sort of individual child therapy, and we were starting to really wrap our arms around the fact that working with the parents was going to be a much more effective way of helping the child. I think that was sort of happening in psychology. COVID came, and what COVID did was sort of level everyone, that we are just humans in this world, trying to survive, trying to get through. And you may be the doctor and I may be the patient, but we're still in this together. And I think that the field, again, I haven't practiced and seen patients for a couple of years, but I am a patient myself. I'm in my own therapy and I'm around it all the time. And what I would say is, I think that the field of psychology is a lot more humanistic because of COVID than it used to be pre-COVID. The shared suffering that we have, the idea that, we're all in this together, and that the connection that we share with our clients and with our patients is the most powerful thing that we can offer. Because now it's really hard to find someone. It was hard before COVID. Now it's really hard because there's less people that are available to work and more people that need help. And I think that when you find someone you really connect with, you don't want to lose that connection. So I think the field of psychology is realizing that, yes, we are experts in something, but parents are also experts in their child. And that if we sort of treat each other more as two people, going on a journey together, rather than I'm the doctor and you're the patient and you're going to listen to me, that's sort of like a very outdated, older model. And I think that that's what we try to do at within the psychology department under Francine's leadership is really think about the entire family, not just the presenting problems in front of you, and really integrate ourselves with the whole family knowing that our clinicians are making a connection with the entire family. It's not just one person. It's not just the child. It's not just the parents. It's everyone together. And I think that's the most powerful way of helping families.
Yeah, I definitely agree. I don't know, Francine, if you want to follow up on the psychology.
Sure. Yeah, absolutely. And I think another silver lining of COVID, for a lack of better word, is the access that individuals have to psychotherapy services that did not exist before. Even if you were in therapy pre-COVID, over 85% of therapeutic services were being offered in person. Now, we're almost seeing a 50-50 split between telehealth and in-person services. And if not everybody responds equally to both, some people do much better in person, other people do much better in the comfort of their own home. But for those that didn't have access to therapy, maybe they just didn't have enough time to go between work and life, or maybe there was no therapist within 10, 20 miles of their home, they now have access to therapy, and not just any therapy. Therapy itself has evolved. We are able to deliver evidence-based interventions. What does that mean? That means there's research being done on the interventions that we're using. We're using assessments to measure progress to see, is this working? Is this not working? And then that data helps us really with making informed decisions. So it's no longer just everything fits under one therapy umbrella and it's just talk therapy, but rather it's more prescribed. Somebody comes in with a problem and we say, oh, this intervention would be really effective for this problem. And somebody with a different problem would get a different intervention. And we're able to help our patients progress at a pace that they're able to, but also more rapidly than before. So we're really happy to be able to offer these evidence-based services.
So, thank you. Ariel.
I'll talk a little bit about ABA because ABA has changed just like so dramatically since the beginning of, I mean, the first ABA therapist job I ever had was in 2008, right? So I was trained a number of times as a behavior therapist over the years. And, when I first started to be trained, we talked about these like prerequisite, like learner skills, compliance, and eye contact, and things that we just don't do now because we know better. So I think that the ABA field has seen somewhat of a reckoning in terms of the way that we deliver services, the way that we conceptualize, like, what does it mean to do this therapy? What is the point of doing this therapy? It's a question we talk about a lot on the ABA side. Ashley, Michelle, and I talk a whole lot, Lakin too, about like, well, why do we do what we do? And oh no, sorry, my whole screen disappeared for a second. Why do we do what we do? And, at the beginning, when I was first trained, it was, well, we're looking to sort of narrow the gap between what's considered to be a typical developmental trajectory and what is considered to be, all these symptoms of autism that are not, developmentally where a child should be. And that's not really how we at MPG and PA, that's not how we conceptualize what we are doing anymore. So I think ABA is in it, right? We're trying to find the best path forward. ABA is an evidence-based treatment, but there's been a lot of missteps, and we really feel that it is our duty, our responsibility to not just come up with training programs and supervision that really highlight what the kind of work that we want to do, but also to disseminate that information, to really be out there talking about what does it mean to do this therapy, why do we do what we do, and how can we do it better. So ABA is really just in it in terms of what comes next.
Yeah, absolutely. Ashley or Michelle, who wants to follow up to that next?
Yeah, I'll go. I'll kind of briefly give a little bit more. Honestly, Ariel's experience was similar to my own in that when I came into the field 13 or something years ago. It was entirely different. And I think as specifically as social media and as kind of open communication, not only with other clinicians, but with autistic individuals and the populations that we're serving have become more easily accessed. I think our field has really gotten to start evolving and really reaping the benefits of being able to hear more directly these firsthand accounts of autistic individuals who have gone through ABA therapy, especially in the 90s or the early 2000s or the early 2010s, when really the goal was to, like Ariel said, close the gap between people who had developmental delays and neurotypical peers. That involved a lot of teaching autistic kids to withhold pieces of themselves or to act in ways that was abnormal to them or not comfortable to them. Things like the eye contact and I mean, hand flapping was a thing that I would say 100% of programs. So like if a kid flaps their hands, like that's a huge no in 2010. And I think as we've gotten to hear more about firsthand lived experiences and we've gotten to start reflecting on the things that we're teaching and why we're teaching them, we've gotten to see a massive evolution in ABA, where now we really are, you know, trying to help autistic kids with their autonomy and learning to be able to advocate for themselves in whatever way they can. And I think we have a long way to go. I think if you ask this same question 10 years from now, they'll look back at this time and there'll just be massive differences in how we're practicing in the future. And I think that's part of what's so exciting about being in the field of ABA right now and with MPG right now, is that we really are trying so hard to kind of be a part of that positive change to teach autistic kids how to communicate and how to enjoy the things in their everyday natural environment without making them uncomfortable in a way that maybe we previously had.
Absolutely. Ashley.
I mean, I think, you know, both Ariel and Michelle's experiences, I mean, I would be repeating all of the same information. I think like what they've stated is very much like what I was going to share. You know, when I was an ABA therapist, there were things that we did with programming where I felt like, yeah, I don't love this, but this is what they need. You know, like it's kind of like pushed it down. And I thought back, like, I don't even know what would have happened if I would have like protested an intervention. They probably would have thought like, well, you aren't equipped to do this, so this is probably not the job for you. But you know, I'm glad that I can look back and have learned and grown from that. So yeah, I think that they did a great job sort of summarizing what I was gonna mention there also.
Yeah, I agree. I think with any field that you're going, but especially, you know, like Francine said, taking away the mental out of the health is within the health field and the human services field, there's a lot of room to grow, and there should be. We are evolving everybody's day-to-day lives. I can tell you that I never would have imagined that I'd be working remote. That is a whole new world that we're living in. Things are continuing to evolve. And I think if our practices don't evolve, that's where we need to start raising concerns. If we remain stagnant, we're not providing the most quality care. And so I think for anybody here who's looking to get started in the field of ABA or psychology, and you have questions or you have concerns about a way that someone's teaching you or a therapy that they're having you implement, raise your concerns, ask questions, challenge the professionals that are teaching you, because they shouldn't fight it. It should only make them a better clinician to explain the process that they're implementing, why they're doing it, and how it matters to the client that they're serving. So I think kind of going back to the advice, that's what I would give for this question is we should be evolving our practices. And Ashley just made a great comment. I felt the same way 10 years ago when I started in the field, that if I raised a question or I protested an intervention, that you're going to get kicked to the curb and you're going to lose your job because you're new here. You don't know what you're doing. So you just do what you say. But now knowing more, it's important to gather the information. If you want to be a clinician as well, you need to have the information to make informed decisions. And that starts as an entry-level person in your field. All right. Okay, so we have one question that came in the Q&A, so we're going to skip question 5. And the question was, generally, what do psychology or therapy practices look for in new candidates? So I'm going to challenge all of you to narrow it down to one quality, and you cannot repeat what somebody else said. And you can use our core values, but I am challenging you to think of something outside of our core values, because I know that that's something that we all lean towards, and it's a very important part of our hiring decisions at MPG. And just a little side note, this question is a loaded question because not all psychology and therapy and ABA practices are created equally. So what we look for at MPG could be drastically different from what you look for in what another practice looks for. So whoever wants to go first, what is the first quality you look for in somebody pursuing a career within the field that you're in?
I could start.
Go ahead.
So when it comes to a group practice, as opposed to being a solo practitioner, the value and the benefit of being part of a group practice is really having the ability to collaborate with other clinicians, with like-minded individuals, and within a field and a group of professionals. So being collaborative and open to case consultation is really the benefit, and somebody who possesses these qualities is somebody that we would be looking to hire.
Yeah, absolutely.
I'm going to jump in before somebody else steals mine, and then I'll have to think of another one. When I'm talking to ABA therapists, there's a few things, but to pick one, I think someone who has empathy in this field, because in ABA, you can teach a lot of ABA skills. Someone can come in, we see it all the time, no ABA experience, and then they thrive. They're making huge differences in their clients' lives. But if they don't have empathy, you can't really teach that, so that's, I think, one of the top things we look for on the ABA side.
I was going to say the same thing, Ashley. And also the idea that meaningful connection, passion about actually working with people, working with children, these are the kinds of things you cannot teach. You could really teach anyone, how to do a treatment, how to do a manualized treatment, but if they don't have that beginning personality that really you can tell they're really there to connect, they're awesome at playing, they really care, you can't teach that.
Yeah.
And I would say that the things that I'm most looking for is people who are just hungry to learn, people who are able to, whether they've been in the field for 0 minutes or 20 years, come into a practice and thirst for additional knowledge, or being actively seeking new methods to practice in their chosen career. If somebody is happy and eager to learn, and they can kind of present that in an interview or in a conversation or in a panel, those are the kinds of people that I feel like bringing on are going to be just flourishing in the field of ABA.
We're running out of good ones, so I better jump in. All these things, obviously, gun to my head, I would probably say, hardworking, someone that is ready to go the extra mile, someone that's not cutting corners, someone that's going to, sort of impress me. Instead of delivering what I asked for, maybe they deliver that plus a little bit more. That to me, sort of someone who stands out, really wants the job, wants to be here. That goes a long way.
Yeah. Awesome. Thank you guys. Those were fantastic. All right. Well, we are at the end of our time. So if we have any other unanswered questions, I will post my contact information at the end, and you can send me an email. I also am posting our social channels here. So our Instagram, LinkedIn, Facebook, and Twitter. And then here is my contact information. So if you have any questions for any of our presenters that weren't answered, feel free to send me an email. or on our website, you can book a 15-minute chat with me, and I'd be happy to tell you a little bit more about our practice, or just anybody's adventures and what fuels their passion. So thank you all for joining us, and we hope you found it informative.
Thanks, everyone. Thanks for attending.
Thanks, everyone. Have a good night.
Have a good night, everybody.